Chapter 25 deals with infections associated with the circulatory and the lymphatic system. So your circulatory system is a closed system. This is your blood that's being transported around in the blood vessels. So it's a closed system. It does transport nutrients, oxygen, carbon dioxide, which is a waste gas, as well as waste products. The lymphatic system is considered an open system because to enter it, it's open in the tissue. It will transport fluid that has leaked out of the circulatory system. It will transport it back and eventually drain it back into the circulatory system, trying to maintain the volume of blood. It will filter it before it puts it back into the circulatory system. Both systems should be sterile. One of the concerns, and we've mentioned this previously, is that if microorganisms enter into the circulatory system, they can now go anywhere in the body. So now you're not treating just in one small location, it can be anywhere. That's another whole huge problem to have to deal with, is if you have these systemic infections. Both systems do contain various components of the immune system. Sometimes, we want our immune system to respond, but sometimes that response actually ends up causing more damage than what the microorganism would have caused if you just left it alone. So major components of the human circulatory system is going to be the heart, all of the blood vessels, so your arteries, your veins, your capillaries. As I said, it's a transport system. And then the lymphatic system, it's going to include kind of this pale green color showing all the lymphatic vessels. It's going to include the spleen. It's going to include the lymph nodes. It's all going to drain back. As a reminder, or maybe for those who have not had AMP yet, it's going to drain up here. The subclavian veins is where it's going to drain the fluid back into the circulatory system. So brief anatomy lesson here. You have your blood coming in over here on the left and the red in the arteriole. It's flowing in. This is referred to as the capillary bed, where the blood's going to now flow through the capillaries, which are the smaller diameter. The cell wall, or the wall of the vessels, are only one cell thick. It's one layer to it. This is where all of the exchange is occurring. You've got nutrients leaving, waste products coming in, and then the fluid is going in the blood vessels, comes back here, and will drain into the venules, which then eventually the venules have a smaller diameter than the veins, so they'll drain into the veins. Over here, the arterioles have a smaller diameter than your arteries. So the blood flow leaves the heart. It goes through the arteries, arterioles, through the capillaries, to the venules, to the veins, back to the heart. The green items, little squiggly lines in here, those vessels, those are the lymphatic vessels. Because they are responsible for picking up the excess fluid that leaked out of the blood vessels in the capillary bed here, they need to be intertwined in there. If they're going to pick up the excess fluid, they need to be close there. When I said it's an open system, this is what I meant. You can notice here on the end, these ends are open because it's drawing or sucking up that extra fluid. If there are microorganisms present within that tissue, it may also draw up that those microorganisms as well. The spleen is one of the lymphatic organs also. It's kind of near the stomach, excuse me, over on the left side, behind it. The spleen has a lot of phagocytes in it, and so as the blood is circulating through it, it becomes exposed to them and can help basically try to kill them. Over here under the far right under B, this is a cross section of a lymph node. You have that fluid, that lymph is flowing in one in. It passes through in here. There's a lot of your T cells in here, a lot like cytotoxic T cells. Your macrophages are here, a lot of cells of the lymphatic system. So they're searching for anything that is foreign, and they can help filter it out before the lymph leaves on the opposite side. And lymph, as it's collected in the lymphatic vessels, it is going to go through, I don't care where it's picked up from, where it's going to go through a series of lymph nodes, not just one. It's going to go through several. And so each time it's getting filtered. The idea is it better be sterile when you dump that lymph, that fluid, back into the circulatory system. Some terms here as we go through with each of the chapters. Bacteremia refers to bacteria in the blood. Septicemia means the bacteria are reproducing in the blood. You're on another whole level now of problems. Viremia is viruses in the blood. Toxemia, you have microbial toxins in the blood. Endocarditis. This is inflammation of the inner layer of the heart. Pericarditis is inflammation of the sac that surrounds the heart. Myocarditis is inflammation of the heart muscle itself. Various diseases are going to cause various symptoms. Vasculitis is inflammation of the blood vessels. Potentially small red purple spots on the skin when those blood vessels rupture. Ischemia is a reduced blood flow. That's usually due because blood vessel is damaged. Lymphangitis is inflammation of your lymphatic vessels. A bubo is a swollen lymph node. Lymphadenitis is where an individual has several buboes. There are certain diseases where that's a common symptom. Zoonoses are infectious diseases that are transmitted from animals to humans. So let's get started. Once again, we're starting with the bacterial infections. Toxic shock syndrome. This causes a toxemia. In this particular case, what we're talking about, it is caused by Staphylococcus aureus, which is a gram-positive bacteria. One of the ways it is transmitted is by contaminated tampons or some other intravaginal product. Prevention. Don't leave products in the vagina for an excessive time period. If an individual gets this, it can be treated with antibiotics. There's a similar syndrome that's caused by Streptococcus pyogenes, which is also a gram-positive. We didn't used to see this that often, and then it was back in the early 1980s when suddenly there was a huge increase of individuals being diagnosed with toxic shock syndrome. And the causative agent was Staphylococcus aureus. And anytime you have a sudden increase, red flag warnings. What's going on here? It begs the question, what happened? Why now? Why all of a sudden? What's going on? What is the common factor between all the individuals who are being diagnosed with this? Well, number one, they were all women. Okay, that narrows it down a bit. And then what is a similar thing that's going on with all of these women? It was finally determined that at that time there was a new company that had introduced onto the market a brand new super absorbent tampon. And all the women who were coming down with the toxic shock syndrome had used that particular brand of the super absorbent tampon. So then you start going, okay, were the tampons contaminated before, is there a quality assurance problem here? No. What they found out through talking with all the individuals, if it's a super absorbent tampon, it does not mean that you can leave the tampon in for 24 hours. You still need to remove it frequently, and people were not doing that. The vagina is warm, it's moist, there's lots of nutrients there. And so it was a perfect environment for Staphylococcus to really just sort of take over. And that's what was happening. So there was a direct correlation with this one particular brand. Like I said, it was a new brand and it's no longer in existence. When everyone using your product is getting extremely sick, and there were several deaths associated with it, you don't stay in business too long. After that, the FDA then required that all companies that make tampons have to put a warning on label on the box or in the box, warning individuals about proper use and not to leave it in too long, which is now standard procedure. Prior to the 1980s, that was not done. Puerperal sepsis, which is often referred to as childbed fever. What happens here is the transmission usually occurs during childbirth. There's introduction of pathogens either during childbirth or right afterwards. Prevention, because it's nosocomial infections, all nosocomial infections have been greatly reduced as compared to 40 years ago, just by proper hand washing techniques and use of antiseptics. So when a woman is pregnant and she's ready to give birth, all the healthcare personnel need to make sure that they are washing their hands as they go from one patient to another, and to use antiseptics. Like I say, you can treat this with antibiotics. There are several different bacteria that can cause this. For the gram-positives, it can be Streptococcus pyogenes, several other different species of Streptococcus. There are several species of Staphylococcus, several species of Enterococcus, several species of Peptostreptococcus, and several species of Clostridium. For the gram-negatives, it could be Chlamydia species, it could be E. coli, Klebsiella species, Proteus species, or Bacteroides species. So as you can see, there are numerous species that can cause this. Wash your hands between patients, please. Infectious arthritis. This can either be acute or chronic. Remember, acute is going to be short-term, chronic is long-term. Your elderly and immunocompromised individuals will be at higher risk. Transmission typically is from a wound or a surgical site. Staphylococcus aureus is gram-positive. That's one of the causative agents. Another causative agent is Neisseria gonorrhea, which is a gram-negative. Both of these can be treated with antibiotics. Osteomyelitis is acute or chronic inflammation of the bone tissues. It can be, the causative agent can be transmitted either during surgery or from trauma. Some of the causative agents are Staphylococcus aureus, which is gram-positive, Mycobacterium tuberculosis, which is, remember, that's an acid fast. Some books will list it as a gram-positive, but most don't. It's usually listed as acid fast because it doesn't take up the gram stain very well because of the higher waxy content of its cell wall. Pseudomonas aeruginosa is a gram-negative. Streptococcus pyogenes is gram-positive, and Streptococcus alcogacea is gram-positive. All of these can be treated with antibiotics. Rheumatic fever. This is caused by Streptococcus pyogenes, which is gram-positive. Usually rheumatic fever is transmitted when somebody has a strep pyogenes infection of the pharynx. In other words, they have strep throat that has been left untreated. How would you prevent this? Treat the pharyngitis first. What is the concern with rheumatic fever is that it can, if it's left untreated, it can potentially cause damage to the heart valves, which can lead to heart murmurs and then additional problems from that. So you want to treat with antibiotics. Other infections such as endocarditis and pericarditis, these are often transmitted by contaminated catheters, dental procedures, piercings, wounds. Dental procedures, if you're wondering, wait a minute, how does this have to do with the heart? When you're having different dental procedures done, sometimes even just, regular cleaning around the teeth, sometimes say the gums get bleeding, it's an entrance point to the cardiovascular system. And so if there's bacteria there, they can then move through the circulatory system and end up down at the heart. If somebody has, this is one reason why, if somebody has a heart murmur, they will usually recommend for any type of dental procedure that you certainly let your dentist know, and you may take antibiotics prophylactically. Personally, I have a minor heart murmur, and so whenever I go to the dentist, just even for my regular like 6 months cleaning, because I did share with them that yes, I have a minor heart murmur. It's age related. That I am given, personally for me, what they do is they give me amoxicillin. So I have to take, if any of you are familiar with amoxicillin, they're those great big old horse pills, as my daughter calls them. So I have to take 4 of those an hour before I go to the dentist. The idea is that in case any introduction of bacteria occurred during the cleaning process, I'm already on the antibiotic. It's going to kill it before it can get to the heart and cause any problems and make my heart murmur even worse. So it's just the routine I'm used to. There are several organisms that can cause both endocarditis and pericarditis. So Staphylococcus aureus, gram-positive, Streptococcus species, gram-positive, Enterococcus faecalis, gram-positive, Haemophilus species, gram-negative, Atenobacillus atenomycete, gram-negative, Cardiobacterium hominis, gram-negative, Agnelia carotis, gram-negative, and Klebsiella kingi, gram-negative. All of these can be treated with antibiotics. So that's the good news. At least everything so far can be treated with antibiotics. This is showing an individual that has endocarditis, that inflammation of the inner lining of the heart. You're looking at the mitral valve. The mitral valve is the valve on the left side of the heart between the left atrium and the left ventricle. And so you are looking, and you can see in the areas that are within that box there of where you've got growth of the bacteria, it's forming these like clumps or nodules almost. That's going to interfere obviously with the blood flow through the heart. Gas gangrene. This is caused by Clostridium perfringens. Remember, Clostridium is a gram-positive anaerobe. It forms endospores. And always stress that it forms endospores because that's going to be a problem. Remember, endospores are always hard to treat. They're very hard to kill. Because Clostridium is anaerobe, it's going to die if it's in oxygen, but the endospore will survive. And then when an environment becomes anaerobic, then that spore is going to germinate. It does produce toxins. Gas gangrene is a very fast-moving infection. So usually what happens if you've had an injury, so the tissue is damaged, or maybe you have a chronic disease where there's damage to tissue, and an endospore is deposited in some way in that damaged tissue, maybe by the injury itself. The endospore is there, it will germinate, and as I said, it's very fast moving. How do you treat this? You treat it first, you're going to put the person on some major antibiotics. Debridement of the necrotic tissue, that's when you have to remove gas gangrene, the tissue is going to start dying. You have to remove that dead tissue. Yes, that's not going to be pleasant, but it has to be done. You want to stop the progression of this infection because it's moving fast. Oftentimes it starts on the limbs, on the feet, on the hands. So you want to stop it before it continues up the limb. You don't want to have to amputate the leg or the arm, but sometimes that's what you have to do to actually stop the spread of the infection. This is a very serious condition. So in this picture over here on the left, if you look at the side here, you notice there's kind of a bluish color here. That's discoloration that's occurring. The tissue under here is dying. You need to start. You need to start antibiotics a couple days ago. Over here on the right, If you're looking and there's some gas bubbles in here, that's due to the infection already. Tularemia is commonly referred to as rabbit fever. It is called by Francisella tularensis. It's gram-negative bacteria. This is a highly contagious bacterium. It is classified as a BSL-3. That means you have to work with it in a BSL-3 lab. Obviously, we are not working with it in our lab because our lab at campus is not a BSL-3 level certified lab. You need to work with it in a laminar flow hood that's flowing the airflow away from the lab worker. It is transmitted by ingesting contaminated meat or handling an animal that's infected. Maybe you get a bite from an infected tick, or it's aerosol. There's multiple ways that you can, it can be transmitted to an individual, so you have to be very careful with this one. You can treat it with antibiotics. So unfortunately, if you do get it, the good news is we can treat it. Over here on the left, we are showing the lesion on this hand where a person has been infected with it. And then over here, the blue, that is the bacteria on a scanning electron microscope. It's been colored blue. They're not normally blue like that. Brucellosis, we're still under bacterial infections. It has a couple other common names, undulant fever, Malta fever, Mediterranean fever. Brucella species are gram-negative. This is a zoonotic infection, meaning that it's transferred from other animals and then it's transmitted over to humans. Brucella abortus comes from cattle and buffalo. Brucella canis is transmitted from dogs. Brucella suis is swine. And Brucella militensis is goats, sheep, and camels. So how is it being transmitted from these animals, whichever species you're talking about, to humans? Is by ingestion of contaminated meat or unpasteurized dairy products. It can be aerosol. It can be direct contact. If the infected animal has a wound and you come in direct contact with it, it can be transmitted to you. This is also a BSL-3 organism. So you treat it with antibiotics. If it's BSL-3, you know that it typically is highly contagious, and usually just be very, very careful working with it. Cat scratch disease. Zoonosis type disease, where it's from an animal to humans. What happens here is cats get infected by contaminated fleas. So the fleas are contaminated, they infect the cat. The causative agent is a bacteria, Bartonella hensii. It's a gram-negative. And so sometimes the cat has it, the flea bites it, the flea goes and bites another cat. So it's being transmitted around the cat. How do humans get it? It's transmitted, as the name implies, because the cat either bit or scratched you. Usually it's mild, usually it's self-limiting, so oftentimes you don't have to do anything about it. It'll clear up on its own. Immunocompromised individuals may develop a secondary complication, so you may have to treat them with antibiotics to prevent that secondary infection. How do you prevent this? Leave the cat alone. Oftentimes kids want to play with the cat. My kids had a cat. One of my kids used to like to always pick up the cat, and one of the other kids whose cat it belonged to, we figured out if you went to pick up the cat and it meowed in a certain way, that meant, I don't want to be picked up, leave me alone. Well, one of the kids would always still pick up the cat. It would meow that way, and then it would finally like, yeah, and scratch. And then the kid would get upset. The cat scratched me. Well, when it's meowing at you, to leave it alone, leave it alone. So prevention, leave the cat alone. Another bacterial infection is called the rat bite fever. Once again, another animal to human transmission, so it's a zoonosis. Causative agents, Streptobacillus monoformis, which is gram-negative. This is what we tend to see here in North America. In Asia, we tend to see the causative agent is Spirillum minor, which is also gram-negative. Once again, how is it transmitted? Well, as the name implies, it's transmitted. You have an infected rat, and you're either bitten by the rat or you're exposed to the rat feces or some fluids from the rat have contaminated the food or water supply. How do you treat it? With antibiotics. The plague. This zoonosis, so it's transmitted from animals, often rodents. The flea is a vector. So an animal is infected, a flea bites the animal, the flea then bites the human. Yersinia pestis is the causative agent. It is a gram-negative bacterium. So bubonic plague is transmitted by the flea. So like I said, it goes from the rodent to the human. Pneumonic plague, this is when you inhale the bacteria. It can be transmitted person to person. Septicemic plague is when it enters through a cut or a wound. How do you prevent this? Well, control the vectors. If you can control the flea population, then it can never transfer from the rodent population over. What happens if you do get sick with this? You can treat it with antibiotics. Now, some people think, oh, the plague no longer exists. Yes, it does. It does exist every year in the desert southwest of the United States is one place. I used to live there, and every summer they used to monitor the rodent population, usually looking at mice in certain areas. They set traps and they're monitoring them. They catch the mice, they monitor them for the fleas. If the rat or the rodent population in general increases, that's usually indicative that you're probably going to have more interaction with them, which is probably going to increase your risk. Why would the rodent population increase from one year compared to another? Typically because in the spring you had more rain. So there's more growth of plants, which means there's a higher food supply available, higher resources, there's more water. You start to see how everything is interconnected. So there were times when I was living in the Albuquerque area in certain parks, sometimes where they would be monitoring, they would end up putting out news releases and saying, in our monitoring process here, it's starting to show an increase. Sometimes parks, they would say, do not let your dogs roam free because we don't want them interacting with the rodents and possibly coming in contact, and the fleas jumping from, say, the mice to your dog and then to you. And there were actually a few times where they closed parks because the numbers were getting high enough that they said, no, the risk is not worth it. And that's one of the problems too, is that the fleas can go from the contaminated rodents. You're out in an area, and because some of you may be thinking, I have no intention of being that close to a mouse or a rat or anything. That's me. But the problem is, if you have a dog and it's running around, and we know dogs are going to go everywhere and chase everything, and so it may come close enough where a flea can jump from the rodent to the dog. Now the flea's on your dog. And then when you get home, unfortunately, now the flea can go from the dog to you. So just be aware of that. It can be treated with antibiotics. And this is just showing kind of how the life cycle can happen, that you have from the flea, it can get on various animals and end up back on you. Yersinia pestis, this bubonic plague, tends to cause buboes, which are swollen lymph nodes, and so that's typically what you will see is this swollen area here. When it becomes septicemic, then it's going to end up affecting first along the extremities. This is unfortunately a very sad, horrible case of extreme necrosis occurring on the toes. This is a blood sample from a patient where you're looking at, it's what they call a safety pin appearance of Yersinia pestis. When you look at it, see right here, they look like little purple safety pins. That's classic and unique to it. That's what you do not want to see in a blood sample. Anaplasmosis, once again, a zoonosis, meaning transmitted from animals to humans. Ticks are the vectors, and well, usually it's ticks, and it can come from chipmunks, voles, mice that are infected. The ticks are basically bite the various animals and then go from the animals to you. So just be careful when you're feeding that cute little chipmunk and when you're out in the woods. Later you might decide it wasn't quite so cute when a tick from it gets on you and if you get sick. Causative agent, Anaplasma phagocytophilium. It's gram-negative. You can treat this with antibiotics. Ehrlichiosis is once again another zoonosis. You notice a lot of these are zoonosis now. Tick is the vector. Ehrlichia chafiensis is gram-negative, and you can treat with antibiotics. Typhus, zoonosis once again. Rodents are another animal host, and body lice can be the vector. Rickettsia prausnitzkii is gram-negative, and that's a causative agent, and you can treat with antibiotics. Marine typhus, the vector here now is a rat flea, and the causative agent is Rickettsia typhi, still gram-negative. You can treat with antibiotics. Rocky Mountain spotted fever, another zoonosis. Tick again is a vector. You're starting to notice a pattern here. Rodents are the animal host. Rickettsia rickettsii is the causative agent. It's gram-negative. You can treat this with antibiotics. One thing I do want to say about Rocky Mountain spotted fever, it does not occur just in the Rocky Mountains. It's where it was first identified, but actually we tend to have higher cases further east than the Rocky Mountains. So just be aware of that. This diagram here shows that, yes, actually it is more prevalent in these states right here. This, it has a fever, but then it also causes this rash. So this is characteristic of the rash. Lyme disease. It's another zoonosis. Tick is a vector. Deer, rodents, birds, all of these can be animal hosts. Once again, the tick goes from the infected animal to you. Borrelia burgdorferi is gram-negative. That is the causative agent. Lyme disease has 3 different stages. It has a very characteristic, early on, a very characteristic bullseye rash. That is classic for identification of it. One of the problems with Lyme disease, it is a longer term disease. The infection, if it's long term, has lasting effects. And often people who have had Lyme disease do often complain of having symptoms. I'm talking months to a year after having been treated with it. You do treat it with antibiotics. The sooner you start the treatment, the better off, and the shorter term the infection is going to be. Lyme disease initially was discovered in the eastern United States, and it has been gradually moving westward across the United States. So you used to think of it just kind of in the northeast area, and it has progressed beyond that. As you can see here, this is the classic bullseye rash. That you see that, you know it's going to be Lyme disease. And then here you can see from a dark field the causative agent. Relapsing fever, once again another zoonosis one. Borrelia recurrentitis is gram-negative. In this one, the vector is going to be the louse, and in Borrelia hermsii, also gram-negative. In this case, it's tick-borne and it's from rodents. Both of them can be treated with antibiotics. This is a blood smear. It is showing from a patient that has tick-borne relapsing fever, and you can see right here. They are spirochetes, as you can tell by looking at them. So there's several of them in here. Let's start antibiotic treatment for this person. Trench fever, still another zoonose. From humans, it's louse-borne. It's due to poor sanitation and hygiene. It is caused by Bartonella cantana, which is gram-negative. You can treat it with antibiotics. Moving on now to viruses. The Epstein-Barr virus, EBV. It is also classified as a human herpes virus 4 or HHV4. It is a double-stranded DNA virus. This virus can remain dormant for a long period of time. It is the causative agent of several different things, including infectious mononucleosis, commonly referred to as mono. This is transmitted by contact with body fluids. It is also the causative agent of Burkitt lymphoma. This can also be transmitted by contact with body fluids. For Burkitt's lymphoma, immunocompromised individuals are going to be at a higher risk. If someone is diagnosed with the Burkitt lymphoma, you treat with various drug therapy. Infectious mononucleosis is usually mild, usually self-limiting, so just treat the symptoms. So this is someone that is suffering from Burkitt lymphoma. It tends to cause these tumors, as you can see here. And for what you tend to see with Burkitt's lymphoma as well, with this virus, it does affect the way the lymphocytes look. And so you notice that when you do a blood smear. Cytomegalovirus, CMV, human herpes virus 5, is double-stranded. It causes a type of infectious mononucleosis, but we call it non-Epstein-Barr to distinguish from the previous one. It's transmitted by contact with body fluids. Immunocompromised individuals are going to be at higher risk, newborns at higher risk, transplant recipients. One huge concern with CMV is a developing fetus is going to definitely be at high risk. It can cross the placental barrier with devastating effects on that developing fetus. In a healthy adult, it's often asymptomatic. So there comes a problem. If you have, say, a woman who's asymptomatic and she's pregnant, how do you know she's got it? To know that that developing fetus is at risk. If you know someone has it, you can treat it with antiviral drugs. Another thing I'm just going to say about cytomegalovirus, in that it is abbreviated using CMV. Be careful sometimes with using your abbreviations. Yes, we use them a lot, as you have seen in microbiology. You tend to, within your specialty field, get used to using certain abbreviations. But just keep in mind that people in other fields also use abbreviations, and sometimes you might use the same abbreviation, but it means something totally different. My background is, for my undergraduate, was very broad microbiology. I had a lot of medical, but I also had environmental, industrial, kind of introduced to all of it. For a while when I was in grad school, I can remember at one point I took a class just for fun. I know it sounds weird, but my point was I didn't need it for credit, so I took it. It was a plant pathology class. So we were studying diseases of plants, and a lot of them are caused by microorganisms. And I was the only microbiologist that was in the class. Most people were some type of agricultural major. And so obviously we're studying plant diseases. And there was one day the professor who knew me, and he knew my background. He was on a committee that I had, so he knew me. And he one day just started talking about CMV. Well, you tell me CMV, my initial thought, because of my medical background, is going to be cytomegalovirus. That's my first place I'm going to. And he's talking about CMV, and then we're talking about implant pathology. Now, I'm sitting there, and my first thought is, viruses are usually somewhat species specific. And in my mind, I'm trying to think of a virus that is known to infect humans that would also infect plants. As we have seen through this semester, you have viruses that may infect other animals, as we've seen oftentimes with the zoonosis. They're infecting another animal, and then usually there's some type of an arthropod, some type of an insect, which is still an animal, that then transmits it to us. So we're all keeping within animals. But even within animals, the viruses don't infect all animals. You have, cytomegalovirus here. It's not going to infect all animals. But it's very unusual that you would have such a wide range where something that would infect a plant is going to infect a person. So I'm sitting there, and I'm sure it showed on my face, then I'm thinking, this just does not make sense at all. And finally the professor, because he noticed that, and so I get called out on it. Oh, Paula, you look like you're confused. And I'm going, yeah, because viral specificity, this is so unusual that you would have a virus that infects a plant would also infect a person. And so he just kind of grinned, and he said, well, what are you talking about? I said, well, you're talking about CMV. And he goes, yes. And I said, well, CMV, my first thought is, yeah, it's devastating for a developing fetus. Immunocompromised individuals are going to be at higher risk. It's transmitted by bodily fluids and all. And so finally he kind of laughed, and he goes, so what are you thinking of? What's the full name of CMV? What does that stand for? And I'm going, cytomegalovirus. And then he kind of chuckled, and he said, to a plant pathologist, CMV is cucumber mosaic virus, which obviously I had never heard of before. And I just kind of went, oh, that explains a whole lot. Then we went on with the class. So, my point is, it's fine to use your abbreviations within your group, within your specialty. Just remember, especially if you move out of that specialty field or outside of that special group, that some of those abbreviations may now take on different meanings. Just be aware of that. This is showing some cells that have been infected with CMV. Typically, the cells become very enlarged, and what they often refer to it as a owl's eye type nucleus. It's enlarged. Yellow fever is caused by a single-stranded RNA virus. The mosquito is the vector for it. Prevention, we've done a wonderful job on decreasing the number of cases of this by having good mosquito control, mosquito abatement programs. This is one thing with diseases where there's a vector. If you can somehow inhibit the vector, stop the vector, then you stop the transmission. There is a vaccine that is available for certain groups, especially if you are going to be traveling to an area that yellow fever is still endemic. You might want to consider getting the vaccine for that. If you do contract it, you treat it with supportive care. You can see certain classic symptoms with yellow fever. It does affect the liver. Oftentimes the individual ends up with jaundice. And so as you can see in this picture, you tend to see the yellowing of the eyes. In places where there are mosquitoes, it is a certain species of mosquito that will transmit yellow fever. That can be a good thing. If that species isn't everywhere, then you're not going to have yellow fever everywhere. There are programs where they trap mosquitoes, and so they can monitor the numbers and the various species. Dengue fever is single-stranded RNA virus. Once again, the mosquito is a vector. This is also known as breakbone fever. Prevention, once again, mosquito control. How do you treat it? Supportive care. Another type of fever is the chikungunya fever, single-stranded RNA. Mosquito is the vector. Usually this is self-limiting. Prevention, once again, mosquito control. Treat with supportive care. Ebola virus. It's a single-stranded RNA virus. It can be transmitted by direct contact with bodily fluids. It can be transmitted indirectly by contact with fomites. Remember, fomites are inanimate objects, maybe a towel that came in contact with the infected person and now you touch it. This is highly, highly contagious, and the mortality rate has always been extremely high. It is a BSL-4 organism. So the only people who can do any type of research and handle it is if you are working in a BSL-4 lab, of which, as we've said earlier, there are only a couple of them in the United States. CDC is going to be your first choice. Military also has one. There is a vaccine that they have been working on. It is showing promise, so they are trying that. You can treat with monoclonal antibodies, as we discussed with those. It's expensive to make those, but you can use those to treat and give supportive care. But you have to be careful when you are treating an individual because it is so highly contagious. Obviously, you're going to have to be wearing strong protective gear. Watch your PPE, personal protective equipment, so that you prevent contamination to yourself and to others. There was a huge outbreak in 2014, and that's when there's been a lot of research devoted towards trying to come up with this vaccine, which thankfully has shown promises now. Their testing is now available. This is what the Ebola virus looks like. As always with viruses, remember the only way you're going to see them is with an electron microscope. So they often have this little loop, or described like a hook on the end of it. That's classic for Ebola virus. Hantavirus is a single-stranded RNA virus. This is transmitted by the inhalation of aerosols from rodent feces or rodent urine. Deer mice, white-footed mice, cotton rat are host. This disease progresses very rapidly, so it's very important to get a diagnosis quickly. It currently has a 50% mortality rate. You treat with supportive care. Hantavirus. This is one I remember. I was living in New Mexico, in the Albuquerque area, in the central part of the state, when this was first identified. It was between 1993 and 1994. And what happened is you had an individual who became sick. Okay, fine, that happens, right? It hit respiratory and the heart. So they had to put the individual on a heart-lung machine. You're talking about young individuals in their mid-20s, perfectly healthy 1 week, and they're dead the next. And you're like, what happened here? And that happened once. And then a few days later, here comes another individual, similar symptoms, suddenly having problems breathing. It's starting to affect the heart rate's being affected, and they're going downhill quickly, and a week later, they're dead. So now you have 2 cases, and then there were 3, and then there were 4. And suddenly you're trying to figure out what is going on, what is the common thread here. Initially, most of the people were from the Four Corners area, up in the northwestern part of the state of New Mexico, where it comes, the Four Corners with New Mexico, Arizona, Colorado, and Utah. And they were trying to figure out what is the common thread. They had to call, because it had such a high mortality rate, initially the mortality rate was almost 100%. And it was fast. When we say this disease progresses fast, I am saying there were people who were perfectly fine, no symptoms, and a week later they were dead. You do not expect to see that with anyone, and certainly not somebody who had been perfectly healthy and a young person in their mid-20s. And that's what was happening. They had to call in the CDC. Help us. We don't know what we are dealing with here. And they finally were able to identify it as a hantavirus. Since they were, once you identify it, it gives you something at least to start. Okay, at least we know what we're dealing with now. As we say on here, it's transmitted by the inhalation of aerosols. What happens is typically we see numbers go up in the early spring and summer. And so we do monitor out there the deer mice in the Southwest U.S., it's usually deer mice. And so what we do is we monitor the population of deer mice. If the population in the spring is increasing, that sends up warning flags that we may have more cases of hantavirus. And if you're thinking, well, who inhales rodent feces? It's not that. The thing is, one of the classic ways of getting infected is that in the springtime, when people go to their mountain camps or a hunting camp, or the summer camp they want to open up, or you're doing your spring cleaning at home and you're going in the garage or the shed or whatever, and you start sweeping out. And as you're sweeping, all that dust and stuff, it's going up in the air, and you tend to inhale. And sometimes that's how you're inhaling the virus. So out there, what the recommendation is, if you are going to be cleaning out something that has been closed up for a while especially, and you open it up, take a diluted solution of bleach and just spray it down. So you're not going to be, basically you're not going to be getting all that dust in the air. You also wear a mask while you clean it out. And that has greatly reduced the numbers of cases. When this was first diagnosed, I remember when they were, it sounds bad, but finally they got where the mortality rate came down to 90%. And you're like, this is still horrible. It is now down to about 50% mortality rate, which is still way, way, way too high. But it's getting better. The number one hospital to be treated at is in Albuquerque at the University of New Mexico Medical Hospital. That's the number one place in the nation to be treated because that's where most of the patients go. And a lot of them, in severe cases, are placed on a heart-lung machine. But with supportive care, then, like I said, the mortality rate has come down. Human immunodeficiency virus, which is HIV. This is also a single-stranded RNA virus. It is the causative agent of AIDS, acquired immune deficiency syndrome. The HIV virus can be transmitted by contact with body fluids, sexual contact, use of contaminated needles. It is not transmitted just by casual contact. Sit down, have a cup of coffee with someone. No, you're not going to get it. How do you prevent it? Number one, safe sex practices and don't share needles. HIV disease is characterized as being in 3 different stages. It's dependent on what the CD4 count is. Remember CD4 when we talked about the adaptive immune system and the helper T cells. CD4 cells are a type of helper T cells. How do you treat HIV? You treat with antiretroviral therapy. It's a combination of drugs with it. There is currently no vaccine against HIV. There has been talk of trying to develop one. That brings in concerns as to how do you test it. And so currently there is not a vaccine for it. When HIV and AIDS first diagnosed back in the early 80s, there was a lot of social stigma attached to it because initially the majority of individuals were males who were homosexual. And then there was a lot of discrimination, basically, that happened. And until they knew exactly how it was transmitted, there were some people who were refusing to treat people. And you don't think you would have to say this, but unfortunately at the time it did. And just as a reminder, it does not matter how someone contracts the disease. As a healthcare provider, it is your job to treat them, and you treat everyone with respect. Their lifestyle doesn't matter. It's none of your concern. So you treat the individual. So this is showing the HIV particles. That's what all those little green dots are. They're coming from a lymphocyte and starting to spread. This map shows prevalence of HIV. This is from 2015. One interesting thing, because there is a social stigma still in some communities with HIV. When I was working and living in New Mexico, I worked with someone who he taught like I did, was teaching microbiology. But in the summers, he was part of a program, and he would go to India. And he was involved with helping them set up certain labs there. And his specialty was infectious diseases. And so that's why they had asked him to help set up some of their labs, especially in rural areas. And it was kind of interesting for me because he was talking about it one time and sharing a lot of different information. I mean, I was asking about it. And at that time, there was still quite a bit of social stigma about being identified as HIV positive or having AIDS. It was one of those things that was not socially acceptable. Nobody wants to be sick with any disease. But he was saying if someone found out that you were HIV positive or that you had AIDS, you were often shunned by the community. And so that becomes a problem when you are trying to test people to see if they have it. And how are you ever going to get the number of cases down if you can't treat the people who have it? You know, it's a snowball effect. So what they found is that India also, at that time, was having, and still is, a problem with tuberculosis. So what they found is they initially tried to open up labs to say that they were testing for HIV, and nobody would come. Because nobody wanted their neighbor to see them come into the clinic. Oh, I saw you go in the clinic last Thursday. You were being tested for HIV? Were you positive? You know, and then no one's going to talk to you again. So what they found, and it always kind of struck me in a way, is it's sad, but sometimes it's almost like all you can do is sort of chuckle and just go, this is ridiculous. I don't really know what to say about this, but if they labeled the clinics as a TB clinic, people would come in to be tested for TB. And that's not a problem. So he was telling me that in India, all of these labs he was helping to set up, they said they were clinics for testing for TB, and yet they also at the same time would test you for HIV. Everybody knew that. But nobody would say that they were being tested for HIV. Some of them knew they didn't have tuberculosis, but they went in to be tested for because they knew they'd also be tested for HIV. So he said it's one of those things. You call it a TB clinic, you really know that it's a TB and HIV clinic, but nobody is acknowledging the HIV part of it, but that's why everybody is going there. And I just finally would just go, okay, I don't know what to say other than okay. With the various disease stages of HIV, stage 1, acute. You just been exposed, you have the HIV infection. In terms of the CD4 cells, you have greater than 500 cells per microliter. You have a large number of the viruses circulating in the blood. You are very contagious at this point. In stage 2, it's classified as a clinical latency. The HIV virus goes dormant. The number of CD4 cells is between 200 and 400 cells per microliter now. In terms of the virus in the blood, it's at a very low level. You may not show any symptoms. This can last for years, especially if you take what's commonly referred to as the cocktail. This combination of, I believe it's 3 drugs of antiviral medication. that's going to delay moving on to stage 3. Stage 3, this is when you finally have AIDS. You have AIDS is when you have less than 200 CD4 cells per microliter. At this point, because the CD4 cells are so few, the immune system is now suppressed. That is what is making you susceptible to all of these other opportunistic infections. How many times with diseases have I said, oh, if you're immunocompromised, you're at high risk? Well, at this point, if you're in stage 3, you have AIDS, you're immunocompromised. You tend to have a very high viral load. You have lots of virus in the blood. You're very, very infectious. Survival rate, once you have entered into stage 3, if you are not receiving any treatment, is about 3 years. Now, if you're receiving treatment, that is going to prolong excuse me, certain your life. In this graph, it is showing, the blue line is showing the number of your CD4 cells. Those are your helper T cells. The red line is showing the number of viruses. So initially you can see your CD4 levels are very high, and then they start to go down, and then when you enter into the 3rd stage, this is when, oh, right here, you're going down and the number of viruses going up. It's not looking good. Moving on to the protozoan infections. Malaria. Malaria is caused by several different species of Plasmodium. As you can see, several different species are listed here. The vector is a mosquito. How do you prevent malaria? Have good mosquito control. Once again, stop that vector, you stop the transmission. You can treat with antimicrobial drugs. The cycle of the Plasmodium is the person may appear well, and then it reoccurs, and then they get the chills and the fever, and then they feel better, and it kind of cycles around. Bottom line is control that mosquito vector, and that's going to be critical in terms of controlling the disease. Here's a blood smear of someone from malaria. Excuse me. Toxoplasmosis. Causative agent of this is Toxoplasma gondii. Cats are the main reservoir. They're the preferred host. That's where this particular protozoan prefers to live, in the cats. So how do humans get it? It's transmitted by contact with feces of an infected cat, possibly ingestion of contaminated food. For most healthy individuals, you may remain asymptomatic and never realize you have it, or it may be very mild. Immunocompromised individuals are going to be at higher risk, and another huge group where it's going to be a problem is, once again, a woman who is pregnant. The developing fetus is at high risk. This protozoan can cross the placental barrier with devastating effects. So, what is the prevention for this? Good hand washing. Another preventative measure that is very effective in dealing the concern with pregnant women is that if a woman is pregnant, do not handle cat litter because it's in the feces. And if you go to clean the litter box and you get dust, spewing, you might inhale it. And so just take it as this. If you're pregnant and you have a cat, here is your excuse not to have to clean the litter box. Personally, I know I have 3 kids. We had cats. And so when I was pregnant, I would tell my husband, I can't clean the litter box. It's your job. And we'll just say I might have neglected after the babies were born to say, okay, it's fine now, I can clean it. I just didn't say anything. And so it's like, let someone else clean it. When you're pregnant, just don't take that risk. It's an easy preventative measures. Just don't clean the litter box. If someone does contract toxoplasmosis, treat with antimicrobial drugs. So this is just showing the progression of the disease and how it can be transmitted. And this is showing it here on the various slides. Babesiosis is caused by Babesia species. The tick is going to be a vector. Both domestic and wild animals can be infected with it, and so the tick transmits it from those animals to the humans. Some people may remain asymptomatic. Your elderly, your immunocompromised are going to be at higher risk. Those people who have severe cases, you can treat with antimicrobial drugs. And this is what it looks like here on the slides. Chagas disease, remember we're still talking about protozoan infections. Trypanosomonas cruzi is causative agent. The vector is the kissing bug. Wild animals, domestic animals, both can be reservoirs, and then the kissing bug transfers it, as the vector. There's 3 stages of the disease. They're classified as acute, intermediate, and chronic. How do you prevent it? Vector control. Some of these that are insects, the different arthropods, depending on where you live, there may be, say like mosquito, you may have good mosquito abatement controls where they spray, you don't have standing water around. In some places, whether it's mosquitoes, flies, kissing bugs, whatever, some people put netting over their beds. That way the insect can't get to them while they are sleeping. If you are someone who likes to go out hiking a lot, when you get home, check yourself for ticks and remove any ticks that may be present. So once again, for Chagas disease, prevention is vector control. You can treat with antimicrobial drugs. Early stages, you're going to have the best results. And this is showing over here on the left on the slide, here's the protozoan right there, the Trypanosomonas. Don't want to see that in your blood slide. And personally, I don't want to see this one either. That's a little bug. Leishmaniasis by the Leishmania species. Sandfly is a vector. There are several animals, once again, that can serve as hosts, including humans. There's different forms of the disease. Some of them are left untreated. If it's a severe case, you can go ahead and treat with antimicrobial drugs. So this is showing it on a slide. And over here is a skin ulcer that is associated with the disease. And then helminth infections. Schistosomoniosis is caused by a trematode, specifically a fluke. There are a couple of different species, as you can see here. The alternate host are snails. Transmission is often through exposure to contaminated water. The fluke can penetrate through the skin. You're swimming in contaminated water, it can penetrate through the skin. Prevention, improved wastewater treatment, education. You can treat it with antimicrobial drugs. So, once again on this, you can see for a lot of these, or for this particular chapter, a lot of these diseases are transmitted by arthropods, insects. So how can you prevent the disease progression? What you do is block that transmission. Control the vectors. If you control the vectors, then you can never transfer it from one animal to the other. So try to do that. The other thing I just want to mention through all these chapters is we're going through the diseases. I don't know, some of you may be frustrated, like, well, what are the symptoms of the disease? Once again, this is where I do the balance, that this is an introductory microbiology course. I'm just trying to have you focus on this organism causes this disease. Don't worry about the details of the disease. That is often studied in a pathophysiology course. which typically comes after this course. And so this is still just intro micro. So as you're reading through the book, comparing to the PowerPoint slides, what I am focusing on once again is this organism causes this disease. Focus on that, okay?